60 years old. I'd been training all winter, starting in January, for an obstacle course race. And on a Sunday morning, March 18th, I took our family dog on leash and I run the normal route that I run. And it was probably a mile out, and the last I remember was getting up into the hayfield.
I had been in Lawrence caring for my grandson and walking 3 miles a day when I started having a little problem breathing. They took my blood pressure that day, and I came to Providence the next day, and the day after that I had my surgery.
First and foremost, it's more than any pills, more than any diet, the patients have to exercise.
Ultimately, our goal is to get you back to doing all the things you want to do and do them with ease. So if you were an exerciser before, we want to get you back to what you were doing, at what level you were at. If you weren't an exerciser before, we also want to develop that routine and get that to be a part of your life.
When I first started, it was a beginning program and very light. I went through phase 1, which we wear our monitor, and the nurses are able to keep track of us as we're exercising, making sure we're okay. And we go into phase 2. Our exercises become a little more intense. And then I'm now in phase 3, or the graduation class, I guess, and we set our own programs.
They come here because they do enjoy the proximity, having the convenience of the hospital close to their home.
I work at Ortho Case here in conjunction with Providence, so I chose to do the cardiac rehab here with the convenience, and I know these people are very caring people. They're very professional at what they do. I've watched them. I walk by here every day in my work duties, going to the OR.
I think what's important with respect to cardiac rehabilitation is knowledge to the patient and education to the patient. It's very, very important as part of their rehabilitatory program in form of getting back into the community healthy and doing it in a safe manner, in a manner where you're being seen by a cardiologist periodically and also being monitored during your exercise performances.
After you have a heart attack, you're always afraid you're going to have that next one. And I felt so self-assured, comfortable to be here, where I knew if anything happened, and something did happen.
We're very excited about the new cardiac rehab program in Rock Creek, because that would provide the same services to our community out in Leavenworth, and to all our patients that cannot make it out to Providence. It will be so much easier, closer to home, and it's going to be state-of-the-art.
We're excited. We think there's a growth opportunity, and there are a lot of patients out there who can be served with all the techniques and technology we have.
We are seeing more and more individuals from Leavenworth that are being treated here at Providence. To have a facility up there will meet that convenience. Being able to offer them a place to exercise that's close to their home or close to their work.
People need to be aware. It doesn't matter how good a shape you think you're in, or how healthy your lifestyle is, you can still have a cardiac event out of the blue.
Ultimately, our goal is to get you back to doing all the things you want to do and do them with ease. And it is very important that they do participate and become educated so they can make lifestyle changes and hopefully not have another event again.
The mission has always been that Providence has provided, Providence does provide, and Providence will provide.